Hey everyone, welcome back to my channel. Thank you so much for clicking on this video. If you're new to my channel, my name is Melissa. I'm a registered nurse and this is the Lucky Nurse Lectures. So in this lecture video, we are going to cover the topic of prioritization in nursing. Prioritization is one of the most essential skills in nursing practice, and if you are currently a nursing student, you will likely have a lot of prioritization questions on the Nclex. So it's important to know how to think critically as a nurse in order to appropriately answer those questions when you're taking your exam. So in this lecture, we're going to go over how to prioritize critically ill patients, and we are going to do Nclex style practice problems together. So let's get started. So, as nurses, we're often faced with caring for multiple patients with complex and competing needs. In critical situations, the ability to quickly and accurately determine which patient requires immediate attention can literally be the difference between life and death. Prioritization ensures that the most urgent problems, such as problems having to do with airway, breathing, or circulation, are addressed first, while also considering safety of your patient, the resources that you have available to you, and potential patient outcomes. So there are different principles of prioritization in nursing practice, and on this slide, I have them listed in order of importance. By far, the most important will be your ABCs. We call them the ABCs of nursing for two reasons. One, because they are basic and fundamental, just like the ABCs. And two, because it is an acronym. It stands for airway, breathing, and circulation. So it's also listed in order of importance. Airway is the most important issue. Breathing comes right after that. And then issues having to do with circulation or the circulatory system are third in line. Airway is always going to be a top priority whenever you are dealing with patients because without an open airway, a person can't breathe and they will quickly suffer from oxygen deprivation, and it will lead to a very rapid and painful death. Not to be too graphic. Um, Moving on from the ABCs, next you're going to look at safety. So you're going to look and see which patient is immediately in harm's way. And if a patient is immediately in harm's way, are we able to immediately get them out of harm's way if we intervene? The next thing we're going to look at is acute versus chronic issues. So a chronic issue with a patient is typically going to be a health issue that a patient has been dealing with for a long time. We look at issues that a patient has been dealing with for at least a year as a chronic issue. Although chronic issues can be serious, a patient is considered stable if they have a chronic issue unless there is an acute exacerbation of that chronic issue. So, when it comes to an acute problem, an acute health problem is going to be something that had a rapid onset. Acute is usually met with a greater sense of urgency. So, some chronic conditions, like I said, can have acute exacerbations. An example of this would be a patient with COPD. So, COPD, or chronic obstructive pulmonary disorder or pulmonary disease, is a chronic issue. Someone can be living with COPD for 5, 10 years and they could be considered stable. But if they have COPD exacerbation, it could cause their oxygen saturation to just rapidly and randomly drop from the high 80s to the low 70s, which then automatically becomes an emergency. So that's a case where even though their condition is a chronic issue, they had an acute exacerbation of the issue and it's something that would need immediate intervention. Okay, so next we have to look at actual problems versus potential problems. So, if you have two patients, for example, that are having respiratory issues, maybe one patient seems like they're at risk of desaturating while another patient is currently desaturating. The patient that's currently desaturating has an actual problem right now, and that patient would take precedence over the patient who may desaturate later. That is a potential problem. If it arises, we deal with it when we can, but it's most important to deal with the patients that are actually in the moment having an issue. And then lastly, we have Maslow's hierarchy of needs, which is a theory in psychology that we use in healthcare, and it outlines 5 levels of human need in order of importance. So based on this theory, physiological needs like food, water, shelter should be prioritized before psychological needs like love and acceptance. So all of these needs are important, but if you have a patient who is in desperate need of food or hydration, and then you have another patient who is sad and needs reassurance, the patient that needs food and hydration should be seen and their needs need to be addressed first because they are more urgent and they should take priority. Okay, so now we are going to do some practice problems together. This is the first sample problem. I want you guys to do it with me. If you feel bold enough to pause the video and attempt it on your own, I encourage you to do that. I always do. But we're just going to go through this one together. Practice thinking critically. This is an Nclex style question. And then as we go on in the video, there will be more sample problems and you can pause those, try to do them on your own, and then continue the video and see if you got it correct. So this sample problem reads, you are the nurse with 4 patients. Who should you see first? A patient with COPD asking for pain medication. B, a postoperative patient with a blood pressure of 78/40 and a heart rate of 130. C, a patient with nausea after chemotherapy. Or D, a patient with a broken arm reporting a pain of 8/10. So when you answer these questions on the NCLEX, you're going to kind of go down a mental checklist. The first thing that you're going to look for, do any of these patients have an issue dealing with the ABCs of nursing? So like we talked about on the last slide, you're going to want to run through the principles of prioritization in your mind. The very first thing you're going to look at when you're looking at any of the answer options is, are any of these patients dealing with something having to do with the ABCs of nursing? If not, then you will move on to the next order of importance, which is safety. Are any of these patients in imminent danger and they need immediate intervention? If not, then you go down the list and see, are any of these patients dealing with any acute issues? And then if not, you go down and see actual versus potential problems. And then lastly, you will go through Maslow's hierarchy of needs. But the very first thing that you always want to look for is, are any of these patients dealing with an issue that has to do with their airway, their breathing, or their circulation? So we're going to go through each option and evaluate it. So option A involves a patient with COPD, which could involve airway and breathing, but the patient is asking for pain medications. So there's nothing indicating that there's an acute exacerbation of their COPD. Their issue is with pain. And although pain is important in nursing, and it can be a priority depending on what's going on with your other patients, but in this situation, it likely isn't. Okay, so for example, if you have a patient who is in pain and asking for medication, and then you have another patient who just had dinner and now they're asking for their dessert, of course, in that scenario, you should address the patient with pain. Their needs are more important than the person that needs dinner. However, if you have 2 patients, one is asking for pain medication and one is desaturating, of course, the desaturation takes precedence over the pain. So as of right now, this does not seem emergent, but we're going to go down the list and see if there are any other options that are more important. So the next option is B. We have a post-op patient with a blood pressure of 78/40 and a heart rate of 130. Now, the first thing, anytime you see a problem where a patient is post-op and they've just had surgery, they're immediately not stable. I believe it's within the first 24 hours of surgery, they are considered unstable and they need to be monitored. I want to stress that for those of you guys that are currently nursing students and you're prepping for the NCLEX. Anytime a question makes a point to let you know that the patient is fresh out of surgery or fresh out of an operation, pay extra attention to what is going on with the patient. So patients are considered unstable after surgery due to potential physical imbalances. So after surgery, a patient can have a fluctuation in their blood pressure due to blood loss during the surgery. Their temperature may fluctuate. They may become febrile, which is an important temperature change because that could be an indication of an infection. Their heart rate may fluctuate. So for option B, this patient is post-op, which already grabs my attention. And then when I keep reading, I see that their blood pressure is what we would consider critically low. So this patient, I would say, is in a state of shock. In a state of shock, the blood pressure is low. They're hypotensive, typically with a systolic blood pressure less than 90, or a MAP less than 65. So this patient's systolic blood pressure is 78, which is it's dangerously low. Whenever a patient's blood pressure is dangerously low like this, blood is not flowing to vital organs like the brain, the heart, the kidneys. They're not receiving enough oxygen. They're not getting enough nutrients. That can lead to irreversible damage and organ failure. So, anytime you see shock as an answer option, that will require immediate medical attention because you need to restore blood flow to the patient to prevent fatal complications. So, as of right now, just looking between options B and A, the patient in option B, the post-op patient, is by far more critical than option A. But we're going to just go down the list and see what is going on with our other patients. When I see the patient for option C, a patient with nausea after chemotherapy, nausea is an expected side effect of chemotherapy, unfortunately. So even though there are things we can give this patient to give them relief, nausea after chemotherapy is not an emergency. The patient in B takes precedence over the patient in C. And then moving right along to the patient for option D, a patient with a broken arm, rating a pain of 8 out of 10. Again, pain is important and it does need to be addressed, especially if it's an 8 out of 10 pain, but this issue is not life threatening. So the correct answer is going to be option B, or answer B, the post-op patient with a blood pressure of 78/40 and a heart rate of 130. This patient is at risk for shock. This patient is unstable. This patient needs to be seen first. Like I said, the ABCs are extremely important. So this has to do with circulation. None of the other answer options had to do with airway. None of the other answer options had to do with breathing. This is the only option that had to do with circulation. So automatically this takes precedence and this is the answer. This is life threatening. We need to intervene immediately. So now I have the first practice problem. I encourage you to pause here, answer it on your own before we go through it together. Okay, so of these four options, which patient should be addressed first? Is it A, an asthma patient with exacerbatory wheezing, B, a pneumonia patient with O2 saturation of 82%, C, a diabetic patient with a blood sugar of 250, or D, a patient with a fever of 101.2 after surgery? So, an asthma patient with exacerbatory wheezing would require attention. There are certain cases where this would be emergent, like if the oxygen saturation was low, but we weren't told that. So, especially if you are a nursing student watching this and you're prepping for the Nclex, I want to stress that when it comes to answering questions on the Nclex, you cannot assume or add any information. You have to just work with the information that is given to you in the problem. And we weren't given any vital signs for option A. All we know is that the patient has asthma and that they now have exacerbatory wheezing. So this could possibly be the answer, but we need to look at the other answer options before we make a decision. So moving on to the patient for option B, a pneumonia patient with an O2 saturation of 82%. This is emergent because of the oxygen saturation. So typically a healthy oxygen saturation would be greater than 94. This is by far more urgent than option A. Just looking at this patient needs to be put on oxygen immediately. So moving on to C, a diabetic patient with a blood sugar of 250. Yes, their glucose is elevated, but it's not immediately life-threatening. They're diabetic, so it isn't abnormal that their blood sugar is elevated. They may just need some insulin. This is not a priority compared to the first two options. And then we look at D, after surgery, we do look for signs of an infection, and a fever is a sign of an infection after surgery. I literally just got done telling you guys how if the question makes a point to let you know that the patient is post-op, that means that they are unstable and you should watch out for that. Yes, but 101.2 would be considered more of a low grade to moderate fever. It's not high like a 103, 104. So it does require follow up, but I wouldn't say that it is an immediate emergency, especially not compared to option B, where we have another patient that has an oxygen saturation of 82%. So to answer this question, there's one way you can look at it. The way that we just did, we went option by option, trying to figure out which one was more immediate, which one was more critical. Another way that you can look at these problems is to go through the prioritization of nursing like we did a few slides back. And so that is the way to really think critically in order to answer these questions. So if we're going to answer this question by going through the process of first looking at the ABCs of nursing, we will first look at airway. So when we're thinking about airway, we'll look at all four of these options and see, do any of these patients have an issue that is affecting their airway? Just looking at these patients, none of them do. So we're going to move on to B, which is breathing. 2 of these patients have issues with breathing. That would be patient A and patient B. So automatically that eliminates C and D. We don't even need to look at it any further. Both C and D are actually circulatory issues, which fall under the C of nursing. But again, since breathing takes precedence over circulation, we're only going to look at options A and B. So now that we've narrowed down our options to just A and B, we're going to look at them and see which one is more critical. So for the pneumonia patient, we're told that the oxygen saturation is 82%. This indicates that the patient is already suffering from hypoxia. They're not getting an adequate amount of oxygen to their vital organs. It can cause irreparable damage. So we need to intervene immediately, or else permanent damage will be done to the patient's body. Again, for the asthma patient, the wheezing does indicate that this patient probably has some bronchoconstriction going on, but without being given an oxygen saturation level, we have no idea whether or not this patient is actually in acute distress. So, since we know for a fact that patient B is in acute distress, that is the patient that we would go and see first. Even though the question doesn't ask us, patient A, the asthma patient, would be the next on our list, but the very first patient that we would see is B. So the correct answer is B. Um, Again, this patient has low oxygen saturation, their breathing is impaired. Other issues going on with the other patients are not immediately life-threatening like this one. So moving on to the next problem. Again, I encourage you to pause here and try to answer on your own. Okay, so of these 4 patients, who should the nurse prioritize care for first? So option A is a heart failure patient with +3 pitting edema. B is a stroke patient with slurred speech as of 30 minutes ago. C is a patient with abdominal pain, 5 out of 10. And then D is a post-op hip replacement patient requesting repositioning. So we are going to answer this question going through the levels of prioritization of care in nursing. Again, starting with our ABCs. So starting with A, airway, just looking at these options, none of these patients have issues that are obstructing their airway. So next we're going to move on to B, which is breathing. Again, none of these patients have issues with breathing. So if we were to look at option A, the heart failure patient with the pitting edema, this patient is most likely experiencing fluid overload, which in real life would be accompanied by shortness of breath. But we're not told that in this problem. It doesn't mention anything about their breathing. It doesn't mention anything about their oxygen saturation. So again, as you're getting your mind ready for the Nclex, remember you only work with the information that is given to you. So as far as we know, this issue with patient A is not an issue that is affecting their breathing because we weren't told that. So none of the patients have an issue with airway or breathing. We move on to circulation. When we think about circulation, 2 of these options actually fall under circulation. That is option A and option B. So options C and D are automatically eliminated. Remember, pain is important, but it's not urgent when we have other issues to deal with, when we have other patients that are dealing with something that involves airway, breathing, or circulation. So C and D are automatically eliminated. So now, how do we determine, since we have 2 options that fall under the same category of circulation, how do we determine which one takes precedence over the other? Now we have to use other means to determine which patient between option A and option B is most critical and should be treated first. So, the heart failure patient with pitting edema. The edema does suggest a circulatory issue. Fluid is pooling at the extremities. Now, heart failure is not an acute issue. It's something that's chronic. It happens over time. And remember, when we're dealing with prioritization, acute issues in patients take precedence over chronic issues that a patient has been dealing with a long time. So, option B is the stroke patient who has slurred speech as of 30 minutes ago. Now, when we look at option B is the stroke patient with slurred speech as of 30 minutes ago. Now, in case you're confused, option B falls under circulation because when a stroke occurs, blood flow to the brain is blocked, whether it's an ischemic stroke where tissue has died and there's a clot, or whether there's a hemorrhagic stroke where there's a ruptured blood vessel. Either way, it affects the circulatory system because blood and oxygen are not properly flowing to the brain. Now, with this patient, they have slurred speech that started 30 minutes ago. Slurred speech is an indication of an altered mental status, which is very serious. So they had a stroke. Oxygen and blood are not flowing to the brain. That is causing an altered mental status. And all of this happened within the last 30 minutes. That is not a long time. 30 minutes ago is a very short window. That would automatically be an acute issue. So if you're looking at a heart failure patient with pitting edema, that took a while to develop versus a stroke patient who just started having slurred speech 30 minutes ago. The answer is going to be B, the stroke patient with slurred speech. Now, in general, stroke symptoms are always urgent and require rapid intervention. When it comes to strokes, these patients are always going to be considered urgent because during a stroke, the brain is not getting enough oxygen. Every single minute, really every second that passes, brain cells are dying. And brain cells do not regenerate. Once they die, that's it. So, rapid interventions are necessary anytime you have a stroke patient in order to try to preserve as much brain tissue and as much brain function in a person as possible. And just a side note, in some cases, only for patients who have suffered an ischemic stroke, patients can be given a thrombolytic form of therapy. This is essentially where they're given a clot busting drug to dissolve the blood clot that is blocking the flow of blood and oxygen to their brain. The reason why it cannot be given to patients that have suffered a hemorrhagic stroke is because there's no clot to unblock. It was a blood vessel rupturing. So it can only be given in certain cases and only for patients that have suffered from an ischemic stroke. Now, there's a very strict time window for this drug to be administered, and patients don't always come to the hospital in time to receive it, unfortunately. But this is another reason why stroke patients are always considered critical, and more often than not, they usually take precedence over any other patient that you're dealing with because time is of the essence in every single stroke case. Okay, so now is the third practice problem. Again, pause the video here, see if you can answer it on your own before we go through it together. Okay, so the problem is which of these four patients should be prioritized? A child with asthma using accessory muscles to breathe. B, an elderly patient with constipation for 2 days. C, a middle-aged patient with chronic back pain. Or D, a patient scheduled for routine dressing change. Now, for this problem, we're going to go through the ABCs of nursing. Looking at all four of these options, A, airway, none of these patients are dealing with an issue that is obstructing their airway. B, for breathing, the only option of these four that is dealing with an issue that has to do with breathing is option A, the child with asthma using accessory muscles to breathe. So by default, A is our answer, and we can just end our critical thinking here. So A is the answer to this question. But even just looking at the other options, none of these are even remotely critical. So we'll just take a look at the other options, even though none of them are the correct answer, just so that you can see what the competition was. So working our way up, starting with option D, patient scheduled for routine dressing change. The word routine is in option D, meaning that it's not urgent or critical. Anytime you have a routine task, that's something that can be pushed back. It's not something that you have to do immediately. Option C, a middle-aged patient with chronic back pain. Again, when we look at the language in this option, the word chronic is there, which already means this is not an acute issue. This is not critical. It's not something that had a rapid onset. So this can kind of wait while we deal with other patients. And then option B is the only option that could be a contender for option A. Like if we knew what was causing the constipation in this elderly patient, like if there was some type of blockage, but even then, the likelihood of that being an urgent issue would be low. And more importantly, we weren't even given that information. All that we were given is that this is an elderly patient with constipation for 2 days. Um, so this is not a critical issue. Yes, constipation can be uncomfortable, but the patient can wait to be seen. And I do just also want to take a minute to distinguish inferred information and background knowledge. In the last problem, we talked about a stroke being a circulatory issue because it involves a lack of blood flow and oxygen to the brain. And then the question before that, we talked about pitting edema being an indication of blood pooling. These are things that we know from our nursing knowledge. We know what causes these issues. When it comes to you adding information in the problem that's not there, which you should not do when you're answering Nclex style questions, that would be like in this problem, the child with asthma using accessory muscles. We can assume that the child's oxygen saturation is low just by common sense. We know that it's very likely. However, we're not told that the patient's oxygen saturation is low. That's not information that we should just make up in order to answer the question. Now, in this case, the answer is A. The child with asthma using accessory muscles, even though we don't know the child's oxygen saturation, the child is in more imminent danger than all the other options. But hypothetically, if we were to have an option of a patient that was in some type of respiratory distress and their oxygen saturation was in the 70s, that patient would automatically take precedence because we know for a fact they are hypoxic and that we need to put them on oxygen immediately. Of course, like I said, the answer is option A, the child with asthma. The accessory muscle use indicates that they are in respiratory distress. It's an immediate threat to their airway and breathing, and it must be addressed before the other patients because the other patients were stable or dealing with chronic issues. So now just a summary of everything that we reviewed. When you're answering prioritization questions, especially when you were answering these questions for the Nclex, you're going to want to go through your levels of prioritization, starting with the ABCs of nursing. Remember that unstable patients are always seen before stable patients. Remember that actual problems should be prioritized before potential problems or things that we are worried about can become a potential problem in the future. Acute issues always take precedence over chronic issues, and you need to look at things that are time sensitive. So again, going with the ABCs of nursing, if someone's airway is obstructed, that needs to be addressed immediately because lack of oxygen will lead to death pretty quickly. Things like stroke should also be addressed quickly to save the patient and to preserve brain function. Chest pain, because that can be an indication of a heart attack. Just kind of use your nursing knowledge and critical thinking to determine what is time sensitive and what can be saved for later. So that is it for this lecture video. Hopefully it was helpful. Thank you guys so much for watching, and I will see you in my next video.